Good afternoon, everybody. Today is April 2nd, 2021. This is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. For the most recent information, you can visit the town's website at falmouthma.gov. Emails go directly for health-related questions, COVID-related questions, health@falmouthma.gov. The Health Department's phone number is 508-495-7485. That would be for non-vaccine related, more for COVID questions, complaints, contact tracing, that type of incident. If you're a business and you need to call and ask questions about it because you had a case or something of that effect, you would call that. Or email the health at falmouthma.gov. You can also get information through the county hotline, 774-330-3001. If you go on barnstablecountyhealth.org, you can also get to the Barnstable County Health Department. As soon as you go on there, it asks you if you want to have notifications. It's good to have that on there as well, so you can get notified by the county. They'll also do it when they have weekly openings for vaccine. That'll also give you an update, which might give you a leg up when you're looking for one. So we'll start with with vaccinations first, like we have been. Right now, the eligibility is going to change as of Monday. So Monday, we're going to add ages 55 and older and any individual 16 or over, because that's what the vaccine's approved for. If you have one certain medical condition, you can look at the medical conditions at mass.gov. So that would start on 4/5 this upcoming Monday. And then on the 19th, a couple weeks later, it'll be anybody over the age of 16. And so usually what happens is a lot of desire to get it when these eligibilities open up, and it does take a little time for you to find one. But as you plug away, you'll be able to get it. So that's where we're at as far as who's eligible. I've shown this for the last week or so. This is the eligible sector workers, so regardless of your age, if you're in the food industry, consumer goods, public works, sanitation, court system workers, different types of people. I've sent this an email link for not a registration, but for a survey if you wanted to be notified of a vaccination. Availability, that link was sent out to all food workers, and I also sent it to the chamber. As we get through that first restaurant group, we would work our way, and when the county lets me know, we'll open that up and send it out to other workers. That is more for the food industry to start, try to get them through it first, just trying to make it so that it doesn't overwhelm the system. But if you're a sanitation worker, you're free to go on the site like everyone else and try to get a vaccine. So that's been about a week or two now for this one. As far as vaccine registration, you can always sign up with the pre-registration at the state. That's only for state sites, so that wouldn't work for the county's clinics. The state only has it for their mass vac sites. That's at Gillette and Dartmouth for the two closest. The rest would use the COVID-19 vaccine availability site or massimmunizations.org, upcoming clinics. Right now, 12 o'clock, the clinics for next week go on. So next week, about the same time, the clinics for the following week go on for the county. So right now it's at 12:05. So that goes on. The 3,500 or whatever doses that are available, let's say 3,000 doses that are available, will go pretty quickly, especially when a new age group comes into, or a new eligibility group comes to open up. Then you would register, get yourself an appointment, and that would be at the Barnstable County sites. You know, when you go on these websites, you can also see the CVS's for the opening, the Walgreens of the world. The pharmacies do a really good job as well. So that happens, or if you find and I'll go further into different groups and different other ways for certain people to be able to get vaccine. This is one of them. So if you're a senior and you're vulnerable and you've really been left out of this whole process of trying to register, you should be calling the Senior Center at 508-540-0196. Been very effective through Cape Cod Healthcare. It's not an online registration, so you would be directly contacted by Cape Cod Healthcare. That's how we've got so many of our seniors done. We'll talk about the percentages shortly. If you're homebound, you cannot make it to a clinic in Falmouth. We use the Community Health Center of Cape Cod. Call the Senior Center. If you feel you've been left out and you can't leave your home, or you're a caregiver and you have somebody who can't leave their home, you should be calling the Senior Center to schedule that with the community, and it will schedule that with the Community Health Center. Essentially, we get a list, we send it to Community Health Center, and they'll make a contact with you or your person you're taking care of to help get that person done. So we have our own homebound system. And also, if you're not able to get a vaccination and you're a senior citizen, you're over 60 years old, you're struggling with a computer, the online registration, they'll talk to you at the senior center. And they've done a great job at the senior center, so congratulations to them. And so this program is still in effect. So the Cape Cod Healthcare is still getting vaccines directly from the state. Let's use them if you qualify. The Cape Cod Regional Vaccine Consortium, who set that up with Cape Cod Healthcare, also can help with a second dose appointment. So you can call the health department or the senior center, and we can send your information to the consortium. Again, Cape Cod Healthcare, Barnstable County, get a list of people struggling to get a second dose, and they'll reach out. Okay, so if you're having trouble getting a second dose appointment, you can again call the health department or the senior center. The eligible food worker that I just talked about, I did send an email to all permanent holders. If you are interested in the information, you can email us. I can send you the link. It doesn't get you an appointment. It does get you on a list to be scheduled for a shot. Paperwork would still have to be filled out. So it's not an automatic. Don't stop looking because we sent you, if you asked me for the link and I sent you the link, and you filled out that survey form and sent it back and just hit send, it goes to Barnstable County into a clearinghouse. That doesn't give you an appointment. So you would still want to get an appointment until you hear. If you hear from the county, somebody calls you up out of the blue, and if you've done this, make sure you're answering your phones and checking your junk mail and things of that nature. You get a phone call and it says, hey, Cape Cod Healthcare, we're here to see if you want a dose, you're a food worker. If you hear that, then you can do it that way. So that's one avenue for you. As far as supply is it's a little bit higher for next week. I think they got an extra few hundred doses. I think they're at 4,000 for next week, but that's not a guarantee that they'll remain at 4,000. But they are, told that they're going to get at least 33,510 a week, which is 3 cases of Pfizer. This week, Tuesday, Wednesday, we had big, decent-sized 900-plus dose clinics at the Four Seas, and yesterday at the fairgrounds. The same schedule for next week. So if you're online registering at 12 o'clock today, that you would have the fairgrounds for Thursday and then the Four Seas for Tuesday and Wednesday. Okay, that usually goes up. That availability goes up on Friday, and it does go relatively quickly, and it still will, especially once you get to the 19th of April when it's open up to everyone else. It's really going to be tricky for a while. We're going to get there, and I'm going to talk about how we are vaccinated shortly. So you continue to look at the pharmacies, the CVS's, I believe both are doing it now, Walgreens and Mashpee, the Shaw's has done some, Cape Cod Healthcare has been a big part of this, and veterans, you can always go to the VA, but you would have to travel to Brockton for that, that's the closest one. So there are avenues, people are getting vaccinated, once your eligibility comes up, it makes it a little tricky because everybody's sort of looking at it for the same time, that's in your sort of category, so. As far as vaccinations, we're at 5%. With individuals in the county with at least one dose administered, so at 44%. That's a 5% increase from last week. Fully vaccinated has a 4% increase, or 27, so we're about a little over one quarter of the county has been fully vaccinated. So, and that number's higher than the other counties, so the complaining, I guess, that we did early on about, because this is where it should be because we have a lot of seniors, so our eligibility came first. So we should have been a higher percentage, and we're now starting to reflect that, so that's good. So this chart's real important. This is where we currently are. This is released by the state every Thursday, and where we are as far as the town. Over 75, at least at 90%, a 2% increase, have had at least one dose over the age of 75, and 62%, a 4% increase, are fully vaccinated. 65 to 75, we're at now 80%. That's a 5% increase of at least one dose. And one dose is quite effective. Some countries are using it as they're all doing everybody one dose and then doing the second dose at some point in the future when they have more doses, using a different strategy. So if that's a pretty good number. Almost half at 48%, which is a 19% increase. Are fully vaccinated and have received their second dose. And that makes sense because that eligibility came a little bit later. So now the 24, 21 days roughly since it's been their eligibility, so then that's why that number is going to be higher. Now that is, we've gotten to the 60 plus. Now that number goes up. You have 42%. That's a 15% increase in 1 week of residents with one dose. Fully vaccinated has gone up 1. Eligibility has been a lot sooner, so you'd have a lot less, you would be gaining there less, so it totally makes sense. 30 to 49 are up 8% to 28%. 15% fully vaccinated. 20 to 29 is 19%, which is up 6%. That's where you start getting into the eligible groups of the food workers and so forth. That's where you see them taking advantage of it. So again, I just want to explain, if you're a senior and you've been struggling and you're one of the 10% that really want one, you're having a lot harder time getting it because you don't, the kids, the younger group is generally better on getting the computer to work and getting their registration. That's when you should be calling the senior center. Please call if you feel like that 10% that's been left out. Okay, so that's where we are for vaccinations. It's pretty in line with the county. You can see that we're 44% with one and 27% fully. That's exactly the same number at the county for the entire county. So we're getting there. And again, really, their eligibility after the phase 2 started February 1st. So 2 months in, that's where we're at. So another 2 months, then we should be, everybody should be well up into there, especially if the vaccine doses increase. Okay, so that's it for vaccinations. Cases, it's been an ugly week. We're at 1,381 cases. That's 94 confirmed cases over the past week. Actually, that shouldn't say March 19th. That should say March 25th. Sorry about that, 26th. So over the last 7-day period, it's been 94 cases. 29 probable cases. Sorry, I should have added that up. I did erase it. So it's been 38 cases this week alone, so that puts us pretty close to 50. So for the month, but that 38, so we've had 38 probables this week and 94 confirmed cases in 1 week. That drops, obviously, our isolation percentage down because those are recent cases. They're not out of isolation. We're still lower than the county in terms of, been hovering right at that 11.1% of all cases, where we're 14% of the population. So, again, 38 probables, that's the rapid antigen test, and 94 confirmed in 7 days. That's high for us. So, that's where we're at for this week. Again, contact tracing is as good as we've been. We've really got our groove with that. So we keep doing the contact tracing, mainly with the VNA, just the VNA and us being able to do it. We haven't had to transfer cases to the CTC lately. The VNA and the health department have been able to handle it. This is the weekly chart. You can see that in 1 week, that's our biggest 1 week jump. So we were doing that 6 weeks or so, 7 weeks of the 25 to 35. We're now at 90. Which is the second highest total we've had, and the single biggest 1 week jump. It has been, now to talk, well, then you say, well, we're vaccinating, and why do we have a high count this week? Our average age, taking all the cases and averaging the age, is 48.9 since the beginning. The average, if you just went the last 2 weeks, 3/22 to today, is 34.4. That's the group that's not vaccinated. So, or much lower rate of vaccination. So it makes sense. It seems that the older people that have gotten the vaccine because their eligibility was up first, it doesn't seem to be hitting them for obvious reasons. So it makes sense that the average age for the last couple of weeks would be lower than since the beginning of the pandemic because of vaccinating of our older population. And so that's where we're at. So if you can get a vaccine, get it. There is variants out there. There's both the P1 Brazilian variant and the B117 British variant. They're both out there. So they do spread quite a bit easier. So a household that might have been able to control it, maybe have another person in the household, you tend to see more households. It's harder to protect yourself when you're in a household with someone and they're quarantining. Things like that. It just spreads easier in settings like gatherings and indoor things like that. And so the cases have gone up, with no doubt. This chart just shows by week. The tighter the circles and the flatter the curve, the flatter the line, the better. You can see we had that, late mid-December to early February. You can see the spacing and the jumping, quite a bit of jumping. But you can see that we had the biggest jump over the last week from this week. So this is not good news. And it's going to take a little while for that to come down. It doesn't come down right away. Looking at our, we've talked about the gray, green, yellow, and red being in the highest infection rate. We are remaining yellow. Okay, we've only had 2 weeks in red, which was in January. I don't think there's many towns that have been able to keep red away as well as we have. But notice that we do have a whole 1.5% increase in percent positivity, and over double our incidence rate over the last week. I did say last week that we would have, we were looking at an increase, and we have. If you look at Barnstable County down below, it's got the highest incident rate and positivity of any county in the state. It's the first time that's happened, but it's been the last couple of weeks. 6.25% is like a full 2% higher than any other state, any other county in the state. Incidence is well like 10 per 100,000 higher. It's 40.2, with the state's average is 25.6. So right now, Barnstable's the county is getting hit hard. This shows you, this is week to week. So on the left is last week's chart that I would have shown you, and this is today's chart from last night's data. So that red line is just showing you 30 per 100,000. So we had two towns over 30 per 100 per thousand, which was Yarmouth and Barnstable, and we had Sandwich and Mashpee really right on the line. You come over here to the right, you see the same 30 line. You see that Barnstable and Yarmouth are over it, but also Sandwich and Mashpee and Dennis and Brewster and Harwich are over it, and we're a lot closer. So you see that all the cases are just in general increasing over Barnstable County. It is a ripple effect that is coming from Mid-Cape's original outbreak. They're still dealing with it, and it's worked its way here. So you have more towns in the light blues where we were gray before. It's been working its way out. And so, again, it's social distancing, it's gatherings, it's not traveling, it's being careful with what you do. And so that's where we're at. So hopefully we can keep it down. Again, case counts, you're going to see the same thing. You can see the arrow moving in the upward direction. We're starting to mimic what we saw in the December and January. You can see where we started to creep up in somewhere mid to late November, and it crested up around end of January, started to come back down in February. Now we're working our way back up. Now with vaccinations, we should be able to, the vaccines do work quite well with all the variants, so I hope we can keep that flattened out, and not to the same extent, but the numbers don't show that we're doing too well with it. Plus, they're the variants, so they spread a lot faster, even with the vaccination. So the number, we don't know. Hopefully, the vaccinations can catch up, especially among the younger groups as we get through time and sort of flatten that out. But that's where we're at. So the variants are really a lot more contagious. As far as hospitalizations, you can see we were normally in the teens, with Falmouth being 2 or 3, Barnstable being in that 12, 13, 14. Then it jumped up to 23, and now they're at 30. So you can see that there's still an increase of the hospitalizations week to week, which is indicative of having more cases. More cases, you can have more hospitalizations. Statewide, been on an uptick. It was in the 13, 14, 1500s. Now we're sort of consistently in the 22, 3, and 400 per week. You can see the same thing with the age groups. You can see that their age groups, a lot less cases above 60 years old, a lot more cases below. It's because of vaccinations, and perhaps in the social distancing aspects of that as well. But it's mainly, I think, with vaccine is really helping keep the infection rates lower. I think if we didn't have a vaccine with the two variants around, the numbers would be really, really, really bad. So I think, part of that is the vaccine. Again, part of it is the severity of how people are taking social distance and so forth. Generally, the older you are, the better you are with the social distancing and watching what you're doing, because of that the disease could be a lot worse for you. So we're slightly on an increase in all these sort of metrics here. Again, even as the state's vaccinating as much as they can, as much as they're getting for an allotment, we are seeing, again, hospitalizations starting to curve a little bit back up. Positivity is curved up from, I think, 1.6, 7, somewhere in there, to 2.5 for the 7-day average. So, deaths are still coming down, but that's sort of a residual of before. It does take, 20, 30 days sometimes for a death to occur with a case, so there's a delay to that. If the cases keep increasing, then you will, delay down the line, have an increase in deaths. So that's it about the cases. Testing hasn't changed. Again, use the Barnstable County Fairgrounds. Try to call them and book an appointment if they have the schedule that works. Generally, they're Monday through Friday from 8 to 2. It's free. So we want you to, if you want to use the county, it's a drive-through. It's set up we basically use the vaccination site to do these. It is free. You would call the fairgrounds. The fairgrounds have been great. They'll take care of all the paperwork for you. Just show up and get a test. Obviously, they're not open quite as much as Convenient MD and the CVS's. You're going to, if you want to test on a Sunday, then that's where you're going to go to CVS or Convenient MD, places like that. Cape Cod, Falmouth Hospital, I believe, is still doing it, and the Community Health Center of Cape Cod also tests as well. Okay, as far as social distancing and all of that fun stuff, you still got to be diligent. If you haven't been vaccinated, you definitely want to, with the two variants in the caseload, especially here on the Cape. It's hit us harder than it's hitting any other county. You need to make sure you get the social distancing, the face coverings, hand washing, hand sanitizing. Local travel, right? So now you're thinking, well, it's in my own backyard, so I need to, think about what you're doing with your own travel locally, not just traveling that you're doing outside the area. So, that's the thing. Parties, gatherings, indoors, no social distancing, those are causing problems. And so you need to be careful out there. It's going to take a little bit of time for the cases to come down. When they come up, they don't just go right back down. Think about what you're doing, especially if you haven't been vaccinated yet, and do all the right things that you need to be doing. Everybody knows what that is, so I don't need to go over that too much because everybody knows what that is. So that's what I have to say about that. So as far as a recap, updated vaccine eligibility, so 55 and older and 16 plus with one special listed medical condition. Falmouth resident vaccines are similar to other Cape towns, right on spot actually. State metrics are showing a steady increase. Barnstable has got the highest rates in the state. Falmouth had a very high amount of cases this week, second highest that we've ever had in a particular week. Community spread is occurring and is most likely going to continue to increase at least another week. That's just usually what happens. It could flatten out. I hope it does. But it will take a couple of weeks for this to go down if it stops. So if we can slow it down now, it's still going to take a little time. There's usually a delay to that. Vaccines are being administered as it arrives, and supply will get better. Community health centers and pharmacies, those that are working directly with the feds, have seen the majority of the increase. The state has shown us, when we have our twice-a-week calls with the state, that the community health centers and pharmacies are where we're getting most of the increased doses sent to the state. So Barnstable County is getting its allotment. The state's kind of stagnant in the amount of doses it receives from the Fed to give out to the mass vac sites and so on. But what you're seeing is Cape Cod Healthcare, hospitals, community health centers that are federally, there's a federal program that they're with, they're also getting more, and the pharmacies as well. So that's where you're seeing the most increases. So when you're looking for doses, when you're looking through and get to learn the Walgreens and the CVS, the way that their system is set up. Keep an eye on those systems. They're sneaky good. If they're only doing 35 or 50 a day, it's 7 days or 6 days a week, and they're still getting a few hundred done every week. So, pay attention to when they come. I've heard some anecdotal information that they come late at night or early in the morning. That's when they tend to open up for the day or open up for whatever they're doing for scheduling. So just keep plugging away. You'll get there. If you open up that day for eligibility, like on Monday and you're 56 and it opens up to 55, it's going to be a lot of other 55, 56, 57-year-olds that are going to want it. So it might take a week or two. You just have to keep, plugging away at it. So that's it for the update for the week, and I'll see you everybody next week. Thanks.